any questions on any topic you wish, I'll do my best to answer it. And thank you for being part of class today. We really, truly appreciate it. And we're going to be live streaming to YouTube. Please find me on YouTube and subscribe to my channel and try to figure out what's going on here. It's logging me in to a couple different things. All right, we're going to get started, as I said, in just a moment. Let's see if we can do that one more time. All right, so it's not telling me if we're live streaming or not. Let's go ahead and see if we are. I'll take any of your questions that you have. Again, thank you so much for joining us. All right, there we go. All right, it is live streaming. Okay, beautiful, fantastic. I'm glad that it is. And thank you so much. I hope you're having a great start to your week. And let's go ahead and get started now with our lecture. And there we go. Okay. See if we can go back here to our presentations. All right, we're going to talk all about this. Let's see if I have the right file here. Oh, goodness me. Okay, just a little bit of a change here. It's so funny. It's giving me such a hard time here. All right, so any of your questions are welcome. Thanks so much for joining. Let's see if we can correct this here. And we will get started officially. Oh, I love really user-friendly programs. All right, we'll try that. Okay, there we go. Not cooperating at all. There we go. All right. Okay. So this is your Genius Weekly Training. Everybody's welcome to Genius Weekly Training. If you have somebody who's interested in the Genius, what I'd really recommend is that you invite them to our weekly training class, because you don't need to be a Genius owner to attend it. Everybody is warmly welcome to this class, and they can get more of a sense of what we do with the Genius. The real interesting thing with the Genius is that you can use it for so many applications, and people who you're telling about it, they don't know that. So they don't know you could use it for teeth. They don't know you could use it for Lyme. They don't know that you could use it for daily just nutritional testing, for where your spine is out of alignment. And so it's good to bring them to class where we go through these different use cases and you can really learn more. So one of those examples is to test the teeth. Now, we do have a course all about this that we're going to make on sale this week for 40% off. And the course is really the best way to learn and crystallize the concepts that we're going to be talking about today or introducing today. The course comes with 8 of the most comprehensive testing libraries that I've ever created. So I really recommend that you get the libraries that are included in the course by getting the course and watching the course material, which will teach you how to utilize them. So we're going to be going through that, and you can go to geniusbiofeedback.com and you're going to see all of the coupons that you need. We'll talk about that. But the most important thing that you need to know is that the health of your teeth will impact every part of your body. So your body is deeply connected to your teeth. When your teeth are out of balance, there's a cavity, there is a cavitation, there's a need for root canal, which we can talk about. Your whole body is affected, and is affected through particularly meridian lines. And then you also have teeth that are connected to the organs. And so it's just really important that you know that everything going on in your mouth is related to your entire body. And a lot of the ways that both dentists and the toothpaste companies teach us about tooth care is not really the best ever, right? There might be stannous fluoride in the teeth. That's in the toothpaste. That's not something we want to put on our teeth. It's a lot of those different things that are in the toothpaste, they're going right into your gums, and it has different like sudsing agents and things like that. You don't want to do that. A lot of dentists really God bless them, they really don't understand the relationship of teeth to the rest of the body, and they really don't understand about the materials that they're working with and the procedures that they're doing. And so without, lots of great dentists out there, without realizing it, a lot of dentists do a lot of harm. And so you want to find a biological dentist. There's an organization called the IOMT. It's a holistic organization, and it's an industry organization for dentists when they want to learn about biological dentistry and good dental practices. Even in the case of root canals, there are safer ways of doing root canals with lasers and with ozone. You always want to keep your teeth when possible. There are a lot of videos out there, and you have to understand that whenever you watch a health video, you have to ask yourself, is this person trying to be an influencer? Are they trying to get the most views that they can? You can get the most views by creating fear. You can create fear by having a headline that says, you will die if you get a root canal, or a root canal is the biggest predictor of your future, early death. And that's really unfortunate that today, to get education, it's all about getting views, and people will just say anything on a video. And there's a much more nuanced approach to root canals. And I cover that in this course. You can get the 40% off, and I really recommend it because I really talk all about, in detail, about the pluses and minuses of the root canal treatment. We can't come to one conclusion because there are ways of putting a root canal in a safer way with ozone and with certain materials, not the gutta perch, and you always want to preserve your tooth. If you've ever had an extraction, you will know how disruptive it is, and you always have to keep something there like an implant for bone, to keep your jaw bone status healthy, or you're going to deteriorate. You're going to really age prematurely by not having a healthy implant. You have to know which of the implants are healthy. Is it titanium? Overall, you want to really avoid putting metals into your mouth. So there's zirconium implants that you really want to look into with the right biological dentist. And you just really have to know all of these things about keeping your mouth healthy for life and keeping the teeth in the mouth for as long as possible. And there's just a tremendous amount of misinformation that is given to people every day about what rinses they should use, about what toothpaste they should use, even about what floss they should use, because there are endocrine disruptors that are coating some of the flosses. You have to get a natural floss. So we truly have to relearn everything that we know. Now, a really cool thing about the Genius is that you can do energetic testing and energetic harmonizing for each and every tooth. And we have specialized libraries for that. And that comes with that course that I'm talking about. And we are giving 40% off on that course. I really recommend that you watch that course, and it will be life-changing. And then you test and balance with the libraries that will test each and every tooth, and then it will tell you where the energy is off in a tooth. Does it mean that the tooth has a cavity? Not necessarily, but something is off in the energy of the tooth, and you're able to address it with the library. So that is really cool that you can do this. You can also send energy to the gums. You can send energy to the nerves. You just have a really tremendous opportunity to work with the entire mouth, and then work with a biological dentist. Get cleanings frequently. There are some videos that say don't get regular cleanings. I can't justify that, because every time you get a cleaning, you remove that plaque that is going to build up a lot of the damage to your teeth, a lot of the cavities, a lot of the erosion of the teeth due to infections. So, one small cavity is now something like $250. Well, it's less than that to get a cleaning. So get a cleaning 4 times a year instead of every 6 months, and keep the level of the plaque buildup very, very low. And then learn about which of the toothpaste and tooth powders work best to keep that all of that plaque in check. It's really important to know that. And your diet will also be a significant factor in helping the health of your teeth. You have blood vessels that deliver oxygen all over your body, including to the mouth. So eating a high carbohydrate, low fat diet, starch center diet, will help you from overeating harmful fats that could really compromise the health of your vessels. And that would even affect the circulation in your mouth. So there's a lot to know and a lot to think about. All right, so you really don't go to a regular dentist where they consider the whole person. It's so nuanced and there's so much you really do need to think about to really have a good healthy mouth. And new dentists now are getting lasers that can actually drill the teeth. And a really good holistic dentist will have a laser that he or she utilizes to drill the teeth, which takes down the damage that is done to the tooth, because your tooth is damaged every time that it's drilled. And the more drilling that you have, the less integrity of the tooth. So a laser can actually drill into the tooth. This is a medical grade laser that the dentists are taught to use, and it will remove the debris that's needed to be removed. And then a good holistic dentist will also use a light. They can use a light to disinfect the area, and they can also use ozone. If you have infections, a good biological dentist can actually inject ozone into a low grade infection or where you have chronic inflammation, and you may be able to use those ozone injections to avoid a root canal or an abscess or more deterioration where there could be low level infection for a root canal. Why don't you use an ozone injection over a series of weeks and months in order to bring down any sort of low level infection? The health of your gut, if you have inflammation in your body, you're not eating a healthy, clean diet, then that inflammation is going to make the problems in your mouth worse. And that is also related to the microbiome. Your good gut microbiome, both in your stomach and in your mouth, will also help the health of your teeth. So we do have a course that covers all of this, although I'm going to cover some of the concepts today. If you want to take a deeper dive, go to geniusbiofeedback.com and go to the Learn menu today and look at our blog. We have all of the libraries related to dentistry in that blog. We'll show it in just a moment. And we have all of the course, and you can get 40% off all of these. So 40% off for the week with 40, what do we make it, 40 dental. So use 40 dental, there's no space there. Just should be 40 dental for the discount. Let's go ahead and look at some of the concepts. So if you've never known this before, this can really be mind-blowing to really understand the connection between the tooth and the organs of the body. So if you have an issue, a chronic infection, or even a root canal or an extraction, that is going to affect the organ. When you have an organ that's out of balance, it can affect the tooth. So they're kind of a two-way relationship. But we should understand that there's a deep connection between the teeth and the rest of the body. So that's really important. And you could do things like you could do a daily or weekly balancing for your teeth, where you just go and put it on quick balance and balance all the teeth in the mouth. Maybe you do that once a week. Or you could find the highs and the lows, and you could start to explore with the high and low scores, how are they related by testing other libraries. For example, if you saw that maybe tooth 11 came up and it had a very low blue score, then you would also want to look at liver, gallbladder, and vision libraries. And that would really help you to, put all the pieces together, cover all the bases for that person. And you can also draw relationships for the person, tell them, hey, it looks like tooth 11, is really weak right now. There's a really severe imbalance. I want you to know that that's related to your liver, gallbladder, and related to your vision. Are you having any changes in your vision? That could be related to some underlying issue with this tooth. All right, so good nutrition, good hygiene, unfortunately just not taught a lot of these concepts, so let's look at them. Good minerals in the diet, lots of fruits and vegetables, green juices, green powders like alfalfa powder, wheatgrass or wheatgrass juice and powder. Even if you eat a good diet, because there's so many toxins in the air and toxins that are being, sprayed into the food, it's really good to have an alkalizer that will help to cleanse your liver on a regular basis and it helps to keep the pH of your body healthy, kind of fights against the tendency to become acidic. If you eat a starch-centered diet where you really don't eat a lot of meat or dairy, or you keep it to a minimum, it's going to be a lot easier to alkalize the body. Just think about the name amino acids. If you're taking on a high protein diet, you're going to be sharply acidifying your body, and you're going to be tilting the pH of your body to a more acidic state, and that's harder to maintain health. Health of the body and health of the teeth is going to be harder to maintain in an acidic pH environment. Okay, so mostly starch-centered or plant-based foods, a healthy gut microbiome, get some enzymes in, especially after the age of 50 to help your digestion, and chew all of your food really well. So 21 times for every mouthful is what you're supposed to do, but do your best. Just know that you're probably not chewing your food as well as you could be. Okay, I'm concerned, here's a comment. I'm concerned because I have several root canals due to my ignorance, plus trips to Mexico. Holistic dental was the worst decision. I ended up with 2 dead teeth and all the work needing to be redone. That is really hard because you're promised lower dental. You want to really find one of these dentists that is a member. I think it's called the IOMT. Just Google IOMT Holistic Dental Organization, and if I don't have it exactly correct, it's going to come up right away. Organization. And find a dentist that's reputable. If not in your area, probably within a 3-hour radius, get an American US dentist. And yeah, it's really hard to come up with a good nuanced understanding about the root canals. And you just really have to keep interviewing people, interviewing those dentists, and ask other people what their experience is. I just happen to have a really great person in the Portland area, and I've just learned a lot of these concepts over time and with my own research. It is fascinating when you start to get a handle on this, and you can really understand and get your mouth into a good state. All right, so healthy diet, we've talked about this already today. Avoid smoking and alcohol, and avoid alcohol-based mouthwashes and rinse. Don't use those. Don't use Listerine or any type of alcohol base, because that's going to do more harm to your mouth and gums. And actually do the practice of chewing. So make sure you have some raw vegetables, carrots, celery, that you chew on a regular basis. Chewing is really powerful because you want to keep the whole jaw strengthened, and the mouth and the ability to bite. Those are really important, and that really stimulates a lot of the musculature of the jaw. So that's really important. 6-month cleanings or sooner, like every 3 months, 4 times a year. Of course, daily brushing, electric toothbrush or water pick for gentle cleansing at the gum line, really kind of all of the above. And then, or just gentle brushing. You can get a really small toothbrush called a gum brusher, and just gently release the buildup at the gum line before it even takes hold. You want to keep sort of gently, just a real gentle movement at the gum line will release any of the debris that could build up into bacterial activity and then plaque. Daily flossing, but make sure you have a good healthy floss that doesn't have endocrine disruptors as the coating to the floss. So you have to find a holistic version of that. So look for natural organic floss. They even have like a charcoal floss. That's from a company that makes a product called My Magic Mud, which is a charcoal-based toothpaste with some coconut oil. That's a really good one as well. And so just don't use the regular waxed floss. Make sure you get something that's fluoride free. There's really no form of fluoride. What you need to do is you need to eat green leafy fruits and vegetables in order to mineralize your teeth. Glycerin free, I honestly go back and forth on glycerin free. There are some sources that say that it builds up and it can coat the teeth. I actually have not, over time with new research, I found that doesn't actually happen. There is a really good toothpaste called Risewell, which has done a fabulous job to remove plaque and keep the teeth healthy and well mineralized, and that does have some glycerin in it. So I don't actually hold really fast and firm. If you found a good toothpaste and it does have some glycerin, I actually think it's okay. But charcoal, chlorophyll, baking soda, natural essential oils like clove, these are all really great for keeping the health of your teeth. And neem and neem oil are very good for the health of the teeth. I really recommend this brand called My Magic Mud. They have one with silver, they have one with different herbs, and they just have a really creative website. So if you find them online, My Magic Mud, they have bamboo toothbrushes, they have healthy floss. It's just a really fun site to go to and to utilize for your teeth. Another great practice is oil pulling. So recently I saw a video about xylitol pulling. Xylitol is a compelling herb or constituent. It's not really an herb, it's a constituent that you can derive from bark and so forth. And I would say that having some type of xylitol rinse would be immensely helpful. They did make a xylitol rinse that had some fluoride in it, so you want to find a good xylitol rinse that doesn't, or you can even chew some xylitol gum, even xylitol mints. You want to get the xylitol around your teeth, so you can just put xylitol powder in water and then rinse. You just want to get the xylitol on the teeth because it's so anti-infective and helps to prevent the buildup of plaque on the teeth. But also oil pulling, it was traditionally done with sesame oil in an Ayurvedic practice. So you could do it with regular healthy sesame oil that's made for like Ayurvedic massage. And you basically put a teaspoon to a tablespoon in your mouth and you rinse it around. You're supposed to hold it in your mouth for a ridiculous amount of time, like 5 to 10 minutes. But even if you did it just for a few minutes, it's going to pull some of the buildup off the teeth. And you can also do it with this ozonated olive oil. So this is a really cool thing. If you have any issues in your teeth, you could take a little swab and just swab the area around the tooth and hold that ozonated oil on there for some time around areas of the gums. This is a pretty powerful product to use. I only recommend the peppermint though, because the taste is not ideal, but the peppermint really helps to hide some of the odd taste. Do not get the hemp. It tastes absolutely terrible. All right. So how about coconut oil for pulling? Yes, you can use coconut oil for pulling as well. This one is right. This one is ozonated olive oil. That does make a lot of sense because you get the ozone and you get the effect of the oil. I'm going to have to assume that all the oils are somewhat equal and you're probably just looking for the effect of the oil itself. I don't think there's anything truly amazing about coconut oil for oil pulling that's strategic more than olive oil would be. So I think either one. I love the idea that the ozone is in there because the ozone is going to break down to oxygen, and it's oxygen that actually eradicates those bacteria. So I think this is more strategic and it makes more sense, but it doesn't really matter for oil pulling on its own. And I do think there's some qualities of sesame oil that make it unique and why it was used so much in Ayurvedic practices historically. Yeah, the thing with oil pulling is in terms of what they say is like, you're supposed to take the oil and kind of swish it around in your mouth for 15 minutes. If anybody can do that, you can let me know. I think it's way too long. I would just do it for 5 minutes twice a day, and the 5 minutes will seem like an hour. I think Magic Mud is out of business. I think you might be right. Yeah, because I don't see them on Amazon anymore. So with that, which was really unfortunate. They were an amazing company, and I assume that I think what happened is they had a lot of copycats that were able to produce this type of product a lot cheaper. And so I think you're right. I'm gonna have to update this. But what you wanna look for then, if you go on Amazon, you're gonna see a bunch of toothpaste and tooth powders that have a similar ingredient. You pretty much could make your own, take some charcoal, you could rinse every day with silver, right? This is just sort of gimmicky. You could just rinse with colloidal silver. And you could just make your own tooth powder with a little bit of chlorophyll and a little bit of charcoal, activated charcoal. So I think you're right on that. All right, we're gonna talk about genius strategies coming up here. Okay. All right, thanks for for letting me know that the link is broken. I really appreciate that. We'll find out what's going on there. and we will correct that link right after the top of the hour. So thank you so much for letting me know so that we can take care of that properly. All right, so, okay, a lot of people have a lot of endurance. They do their oil pulling for 15 minutes. That is absolutely awesome. Okay, any info about hydroxyapatite, the new trend? Now, people who use hydroxyapatite, I think that's what it's in a lot of the Japanese mineralizing tooth treatments that they say will help you to, it'll remedy a cavity. I don't think that that's true. My sense is that with hydroxyapatite, it's not going to replace the hydroxyapatite in your body, that these have to be built up in the body through different ingredients, like through mineralization, through taking proper minerals, having the right pH and things like that. All right, let's go ahead and we'll just look at this link for a second, then we'll get into, if anybody has any tooth issues that they want to have addressed today, then go ahead and put your date of birth into the chat there so we can work with you. And then let's just see what's going on with some of these links. So the summary really is that this is really necessary for your entire body to be healthy, is to look into the health of the teeth. And so many people have a lot of problems with their teeth because they were not properly trained in, how to take care of their teeth, which is, really unfortunate. So let's see what's happening with these links. And so yeah, if you want to volunteer, now is a great opportunity to volunteer. Oh, I see what's going on there. And if you have any other questions about biological dentistry or any other recommendations, maybe these are things that you utilize. And we're going to get the correct link in just a moment here. Okay, here's the link for the holistic dental course. We're going to go ahead and, oh, I see what's happening there. This should be the link, but let's see if it works. Oh my goodness, why is it like that? All right, well, we'll just have to correct it later if it doesn't come up correctly. It looks like it's got an override link in it, but we will get that for everybody, no problem. And let's just go ahead and we'll just go to the site for a moment and just look at a couple of the things that are here. And here we go. All right, so this is the course that I'm talking about. We'll link it in a follow-up email, and it is going to be the 40% discount. It's just really helpful if maybe you took this course, you can go back and review it. Or if you're new, I would definitely recommend getting the 8 libraries, and they really cover all the aspects of things related to holistic dentistry. And then you also learn, how you can utilize these. So that is, I can't figure out why this wouldn't work. Try to do it this way and put it here. Oh, there it goes. Okay. Yeah, it does seem to be working now. That's helpful. All right, so yeah, so that link does work and goes directly to the course, and you can get that for the 40% off. Now it's 40% off, and it includes all 8 of the libraries. Also, we have a full list right here. If you go to Learn and you go to the blog, you can actually get that right here. And all of the things, the course, all of the libraries are so that you could utilize these. They're all related. They're all related to our topic today. So you can get all of that here, and you can get use the 40 dental coupon, and you can get 40% off. So we have those. All right, to swish with colloidal silver, is it necessary to dilute with water? I have a 15 ppm preparation. That I really don't know, because I've always just utilized, just the sort of Amazon purchased form of colloidal silver. So I've never actually created it or made it myself. That's really impressive that you've done that. And so yeah, you'd have to, I would imagine you probably do need to dilute it. I would think you would want to probably dilute it just to get more bang out of it. But I don't know the exact dilution that would be, required for that. All right, so let's talk about this, which is just some strategies, things that you can focus on. There's an interesting book by Nadine Artemis all about keeping your teeth healthy. It might just be called Holistic Dentistry by Nadine Artemis. And, oh yeah, Holistic Dental Care. And so she talks about actually the health of your pituitary and hypothalamus when they are not stressed, when you're out in nature, when you're relaxing. They actually help you, they interact with the teeth, and they help to keep the teeth from pushing out and being more protected. And when you're stressed or EMFs are affecting you or you're in emotional stress, the teeth kind of reverse. The hypothalamus influences the teeth, and they kind of go into this reverse mode where they're kind of pulling everything in. And so she talks about that in her book. So, taking care to relax, do meditation, just taking overall care of your entire body really affects the health of your mouth and the health of the teeth. So inside the Genius, you can focus on body systems, minerals, vitamins, digestion. So good minerals would be calcium, magnesium, phosphorus. Those would all be necessary. Fluoride, but you want to get fluoride from plants, not from a type of chemical runoff that they decided to put in your toothpaste or in your water. And then, of course, good vitamins for a good immune system. And you can focus on Nogier A. So Nogier A is specifically for teeth. And then for herbs, you could focus on things that reduce inflammation in the body. So if you have a lot of inflammation in your body, that's going to make situations in your mouth worse. So work on cleaning up your gut, reduce inflammation overall. That's going to help to improve them. So we have herbs for inflammation in the herbal section, which is ashwagandha, shilajit, amla, and gynostemma. Now, there might be one on here. My amla might not be on there. So I think it's just ashwagandha, shilajit, and gynostemma are on the herbs panel. And you can search for these alphabetically. Solfeggios that you can utilize would be 528 for transformation and miracle. So for example, you have a tooth that you know has an issue. So you're going to create a balancing session that includes all of these items in there, either in the quick zap, or in the progressive insights. And 285 hertz helps to restore tissue to its normal home frequency. So this could be for your gums or for the teeth. 174 hertz is good for pain reduction. And you could look at the meridians, because the meridians are all directly connected to each one of the teeth. So you could work on the high and low meridians as well. You could place all of these into the main hold tray and run it in progressive insights on the high items for 15 minutes. In general, you want to have, mercury fillings removed. Almost everybody on the planet now knows that. Have procedures done with ozone and laser for faster healing, and find somebody who knows about working with healthy adhesives. Even the adhesives that they use can be highly toxic, and they go right into your gums, and so they go right into your bloodstream. Okay, I thought we were going to do some, let me just see something here. All right, well, I think that it's actually a great time to just do some balancing. So we'll go through all of this that we have here. We'll go through it in class. Did anybody want to volunteer? Okay, so Dahlia wants to volunteer. That's fine. Let's go ahead and see what we've got here. All right. All right, so we'll do that, and we'll actually go through these libraries actually in action in class. All right, so there were some other comments that we can get to as well. And we'll just bring Dahlia up here. All right, so Dahlia, I'll bring you up as a panelist. And we'll talk with you here and talk about this weird tooth situation that you have going on. All right. Okay, Dahlia, how are you?
Yo, hi, Ariel, how are you?
I'm doing well. How about you?
Well, I'm doing great. I just happened to see that you were working on biological dentistry and all that. I'm so interested in that. I had a kind of bad experience in about 2018. So it's been quite a few years now, but I had the on my right side, I don't know what tooth it is. I want to say it was 11 or 12. I can't remember, but I had the filling removed and switched out for the so the mercury filling out for the amalgam. And the procedure went well at first. You know, that they did all of the covering up. I went to a traditional dentist. It was all I had. I was living in Maine at the time. And but afterwards, after the switch, about 2 or 3 days into it, I started having just severe pain
Whoa.
and nerves just kind of all over my body. And it's really weird. I went into dehydration, like where I was nearly fainting, and my husband had to take me to the ER twice, and they just put IVs in me and just found me to be dehydrated.
Oh my goodness, that's really that's the kind of thing that you can I think can happen. And so what is the upshot of it? Where are you today with this?
So I kept going back to that dentist very nicely and just saying, "Can you check? Is it infected? What's going on?" I had no clue that because I have hypothyroidism, that when you start doing all of this stuff, it can trigger Epstein-Barr, it can trigger all these pathogens, and who knows what all happened. But I kept going back, and they would be like, "Oh, it's fine. It looks good. It's healing up. It's doing great. It's looking great." So I literally just kind of pushed through it, Ariel, and was, taking my vitamins and doing my thing. And the pain just diminished over about a 3 or 4 month time. And to this day, I still have a little ache. I keep everything clean. I do pulling. I
Hmm.
do, but I know that I
Hmm.
need to do
Has
something.
any other dentist ever looked at the area?
Yeah, when I go in to get clean, they poke around like it looks great, looks fine. And,
Yeah. Well, let's actually just bring in a little bit more information here. I I want to make sure that I let everybody know it is the IAOMT.
oh,
And so I
good.
want to
Okay.
find a dentist that has this type of certification, that they are part of this organization. They go back for continuing education every year. The IAOMT. You want to look for a dentist that has this type of training, the International Academy of Oral Medicine and Toxicology. They really know all about really all these different nuances. You may need other imaging.
Yeah. Yeah, I'm
Yeah.
certain I've just been, honestly, I've been avoiding opening the can of worms. Like now I'm like, I don't want anybody in my mouth. And I started, like I've got to push through my fears because it was so terrible. Um, and I don't know if it was like they were giving me these rinses afterwards, and those rinses had some chemicals. Anyway, I don't know what all it was, but I've been avoiding it, and just my mouth feels really healthy, but and I'm a vegan, so I don't do the dairy and the meat and stuff. So I feel like, but I definitely I'm back in the Austin area. My family and I we moved back here, and so I can find
Oh,
I will
that's a great place to be able to.
yeah I will
Yeah.
find the I'll find a biological dentist and try and get some referrals and stuff like that.
Yeah, that is a great idea. And I bet that the right dentist is going to kind of figure out, every dental procedure that we have is like, there's some risk involved, and we have to make sure that the right person is doing it. And it's not always easy to find. So I completely understand. But I think with a little bit more investigation, you probably find out somebody will really tell you the truth about what's probably going on.
Yeah, yeah,
Let's go
definitely.
ahead and record your voice so we can
Okay,
look at that. And do you know the tooth number? Did you say it was 11 or 12?
so let's see. I had a bunch of teeth pulled when I was a kid, right? But to put the braces on. Okay. So I'm thinking this one. Does it start at one here in the front?
Yeah, we'd have to look at the tooth chart. Let me give me a moment and
Okay,
we
it's
can
like
bring
the,
up the tooth chart.
I'm gonna see what
It
number it is.
sounds like where you're pointing, I think that is 11 or 12, but that it's on the
It's the fifth one back on the right, the fifth
oh, on
one.
the back. No, then it's not that. This starts so
Oh, I see. Okay.
yeah, one is up here, but that's a wisdom tooth. So it starts with 2 and 3, and then it goes all the way around to 16. And then it starts again at 32, which is a wisdom tooth. And so that's going to swing all the way around. So like sort of like your front teeth at the bottom, that's going to be 24 and 25. And then up here, so again, we're coming
Yeah,
back over
I think
here.
it's
So
3 and
on the
4.
left side is going to be like 11 or 12. So
Yeah,
you're talking, you think it's
3 or
more like 4 or 5.
3. Yeah, I think it's actually 3 and 4 from the back.
Hmm.
And I think that my 5s were pulled. Yeah, I know they were as a kid, and then they squeezed my teeth together. Ugh, it's horrible.
Yeah, that's another thing with orthodontia. There's so many, you could probably write an entire book about the adventures in dentistry of how dentists have, and orthodontists have really, unfortunately, not understood the basic principles of physiology and jaw structure. That's a lecture for another time, but let's go ahead and record your voice and we'll look more deeply into this. So go ahead and I'll start recording in 3, 2, 1, I'm recording.
Hi, my name is Dahlia. A, B, C, D, E, F, G, A, E, I, O, U. Healing frequencies for me from Ariel at Genius. Thank
Yeah,
you.
that's great. The reason that we do the vowels is just because the different tones give us more like a rounded out picture of the voice. You could basically say anything, but the vowels were intended just for that purpose to give me to give more. Oh, we got this picture from last time.
I'm in there from last time,
Yeah.
huh? Or whenever it was on.
Yeah, let's go ahead and we'll get a refreshed picture as well. So just need a moment to do that here. All right, so go ahead and quick picture that we're taking right now. There we go. And we're good. Okay, fantastic. And we're back here. All right, so Dahlia, I'm gonna let you sit back, relax, and we're gonna
Okay.
come back and talk with you in just a little bit, okay?
Okay, thank you.
Perfect. All right, so let's get into it and see what do we do when we're balancing the teeth. What are some things that we can look at? What are some things that we can consider? Let's go ahead and have a look at that. Let's see if we go down here and we have these libraries that are here. What can we see? We have a whole bunch that are related to dentistry. We're just going to go right to that. We'll go back and probably just do the beginning aura as well, just so we can see that, just a little bit tight for time. If you have any other questions, let's see if you had anything going back to the beginning here. Question on what libraries, et cetera, to use for kidneys. Does have a root canal on the front tooth, and that is connected to kidneys. Okay, we have a bunch that are related to kidneys. If you ever want access to every library that we have over 1,300 libraries in all different areas. Doesn't matter what package you started off with, we can give you a special deal where you'll get 80% off of libraries by upgrading to the next package or a higher package like our Master Elite Plus. So just shoot us an email that says upgrade me or I'm interested in an upgrade. We can figure out what package you have and the savings that you would get by going to a higher package. A lot of people opt for our Master Elite Plus because they just want to have the convenience of having every library that we have so they never have to think, do I have this library or not? So that's an option to know about. For a moment, let's just go ahead and see what those kidney libraries are. Technology. There are some solar flares popping around today, so I guess I'm pretty thankful that we have an internet connection and that we're all able to communicate today. And then we have I think we have a lunar eclipse today, and then we have a solar eclipse on the 8th of April. So lots of fun stuff going on. So yeah, we do have quite a few kidney libraries. We have the kidney harmonizing pack, and so we have kidney anatomy, kidney assessment, a kidney gout, kidney solutions, and we have a library just for kidney stones. So if you're looking for one for kidney stones, or if you want one that's related to the kidney and the bladder, We have the kidney bladder tonify and tune up. So this is great for, bladder health and kidney health. We also have the kidney stone clearing, which is really helpful when people have kidney stones. They might be in a lot of pain. And we just have things like kidney anatomy, which is really great. If you're working on kidneys or you're working on anything, you always want to have a library that's related to that anatomy, because you can send frequencies right to the anatomy, right? Why not? Because it's the anatomy that has, the frequency of the anatomy has changed. How about if we correct the frequency of the anatomy? That's like a really novel idea. So another way that you can do that is you can just search for kidney at geniusbiofeedback.com, put kidney into the search bar, and you'll see all of our libraries. And we tried to index even the libraries that are not obvious that are connected to helping the kidneys. So let's go ahead here. And that's a good question. Okay, is there a list of biological dentists nationwide? So that would be at the IAOMT, that International Academy that trains dentists in the principles of biological dentistry. And they have a conference every year. I wonder if a layperson can probably go to their conference and you could learn a lot as well. Well, it's a really interesting aura that we're seeing here. Let's hide the avatar as well. So the first and main issue is really related to bringing in the energy of the heart. We see the strong heart connection. There's a little bit of yellow in it, so it might even be third and fourth connected. Then we see this very large kind of violet color, which this really reminds me of the crown chakra. So there's a lot of spiritual opening, spiritual development, and that is just right next to a very large solid band of purple color, which is related to intuition. And so sixth and second chakra are very, very active. We're very active today in the higher chakras. We're not seeing as much activity in the lower chakras. So then we also have this sort of gray. So this could be related to emotional upset or some type of maybe not sleeping well, something going on there. And then again, we see this beautiful green color kind of on the outer ring as we see it on the inner ring. So a lot of heart connection. We may even need just a heart clearing. Okay, so let's exit out of that, and then let's go to this area here. And now we're going to go ahead and look at the dental libraries. So let's see what we've got. So these are the 8 that are included with the course. So let's look at the actual teeth themselves. So we have all of the teeth here, and we have them all by the name of the tooth. So let's see if we have anything down here. The pulp chamber itself, the upper right first molar, or tooth number 3. So did you say a tooth number 3 pulled? And then there's tooth number 5, and there's tooth number 6. So that's really interesting that they come up. The pulp chamber is like the anatomy of the tooth, but it's not referring to a particular tooth. And then it's telling us that tooth 3 and tooth 5 are of interest. So that's kind of fascinating. So I want them up here in the QuickSap, where I'm going to work with kind of 2 trays back and forth. And then I'm going to put everything that's in blue, I'm going to put that into the main hold tray. This entangled insights function, it just doesn't work. It needs a different function to do that, because it's so disruptive to your flow sometimes in the course of working with someone. Okay, and then up here we have incisors, premolars, tooth number 12, the tooth root, the lower second bicuspid. Now, where did we put that chart? Okay. So let's go ahead and see what we've got here. All right, so we've got number 12. So that's the upper left first bicuspid. So that's going to be on the other side. It's going to be the left side of the mouth. Now, your client might say, I don't have anything, known going on. I've never had a filling in that tooth. I've never had an issue. There could be something emerging. It just today, maybe there's a lot of buildup, and, the genius is going to bring things out for you way before anything appears, either visibly, or even on, X-ray or imaging, things like that. but it's good to balance it on a regular basis, or it may tell you where you have emerging issues. All right, so with the things that are in the quick zap, now we could add some things into things that are in the quick zap. So you can add things in like your solfeggios, and we talked about Nogier A. So you can add in Nogier A right here, and then you can add in some of the solfeggios. Let's go ahead and add in, we said 174 was for pain. We don't really have pain. We'll add it in today. 528. And then, oh, she did say there was actually some pain now that you think about it. So we could just balance that on its own and kind of go back and forth between the two trays. So we could balance this for a minute. And then we want to go, we want to hold that in the tray for now. We want to go back to the custom libraries and look at those dental libraries again. So let's look at them in a little bit more detail. Mineralization. What minerals do we need for the health of the tooth? It says manganese, potassium phosphate. Calcium and phosphorus are very important for the bone health of the tooth itself. The tooth itself is made of calcium phosphate, and phosphorus is really important. Then we also have magnesium, and magnesium helps with bone density. It probably helps with bone density a lot more than calcium does. I think calcium was found to be a constituent that they could conveniently say was high in dairy products, and then it just became a marketing mechanism. And so everything is always about calcium, calcium. But if you look at people who take calcium supplements, it's not correlated with increases in bone density. But if they take calcium and magnesium, magnesium will help with the bone density. And so something, you know, magnesium seems to be related to the hormones of the body, helps the hormones to work better. Has a lot of different functions in the body. But they didn't get in the marketing angle for magnesium. They had to get in the marketing angle for calcium. And then number 3, endocrine balance. So optimizing the adrenals and optimizing emotional stress would be helpful. Clove is a helpful herb for the teeth for today. And then we talked about this, hypothalamic balance and harmony. Fluid flow from the teeth optimized to protect the teeth. Siberian ginseng, pituitary balance, holy basil, insulin resistance harmonized. This could be in very early stages, or it even could be intermittent. It may not really be affecting health on a regular basis, but we can address it with biofeedback, which is really so cool. And then practices and affirmations. So let's look at some of those. We'll add them to the tray. I take all actions that are needed with a positive spirit to support the teeth daily. Oregano, essential oil. My gums are healthy and resilient. Rose essential oil gives you a lot of ideas too about different things that you could utilize. I now take all actions, conscious and subconscious, to support the health of my teeth. So let's go ahead and put that up in the quick zap, where we have this sort of focus tray, and then we have the larger tray to kind of come to new conclusions about, out of everything, what is important. And this is coconut oil pulling, so maybe that really resonates more for her than other people, is that coconut oil. I'm now turning a corner and moving in a positive direction of tooth health. So that's a great affirmation for her. Okay, so let's see, we've got some recommendations. Am I losing the connection between the iPad here? Oh, it's just a little bit slow. A little bit slow. Oh, technology, gotta love it. Okay, now it's, okay, we probably need a class on chlorine dioxide. I'm going to look into doing one on that because it's so powerful and it's so underrepresented. But that's basically MMS, and now it's really called more chlorine dioxide, can really help with chronic infections. And because certain factions have tried so hard to suppress information about it, it should signal to us that it is likely very, very powerful. Hydrofloss. Hydrofloss is like a water pick. Living libations, that's Nadine Artemis's products. So all these things are recommendations, and the colloidal silver is definitely there as a recommendation. Root canal harmonizing, we don't need to do that. Infection clearing, let's see that one. Gingivitis, nattokinase, neem, biofilm chelator, restore healthy gums. And we've got some other ones here as well. Then we go back, and it's just doing a little bit of a delay. We probably need to reset the connection. And then we have number 8, which is all about stem cells. So let's look at that. Tooth regrowth where needed. Pluripotent stem cells. Each tooth experiences regeneration. Tooth stem cells allow regeneration. So these, of course, are energetic stem cells, but everything can be done in the frequency realm. So let's see what comes up as the most important. Okay, the pulp. Tooth stem cells allow regeneration, hypothalamic balance and harmony. So trying to get that meditation in or those nature walks in, trying to reduce some of the stress level. That's some of the bacteria that might be on the tooth, the Streptococcus mutans, sesame oil pulling, the miracle mineral solution, the cell salt silica. There are 3 key cell salts for teeth. This is really weird, that's not turning it down the volume. 3 key cell salts for teeth: calfluor, calphos, and silica. Calphos, calfluor, and silica are three that you could utilize in order to strengthen the teeth, in order to build up the mineralization of the teeth. All right, so see if there's anything else. The crown of the tooth. So it tells us the most priority is the upper left bicuspid. So that's going to be on the upper left side. And then it's working on the endocrine system. It's working, tells us peppermint essential oil would be helpful. You get a lot of new information coming in, and that's good. But you know what? We really just wanted to focus on that one tooth. So then, or a couple of teeth. So then you go back here and just go to your quick zap and balance that for a minute. That's a nice way to make the client more happy and feel like you're specifically addressing their issue, even if it didn't come up at the top of Progressive Insights. And you also have a way that you could send 2 separate playlists. Now, I got this question that was really interesting that I want to ask people for their ideas. So the practitioner wrote in and said that when the person gets a session where the practitioner is there and running the frequencies, they feel a lot. They perceive a lot of the energy coming through. But when they run the frequencies for themselves inside the quantum capsule, it just crashed for a second, inside the quantum capsule, they don't feel that they have as powerful a session. What do you think might be the missing link between the two of those experiences? So this isn't what a lot of people tell us. This is just one person, but I was curious your thoughts. Why do you think that might occur, or why the person might have that experience? Let's go ahead and we can see here. So we got a good response, 48% good response in rectification. So why would somebody get more when they're live with the practitioner than versus the capsule? What would be an argument or why somebody might experience that? Does anybody have any ideas or thoughts about that? And we'll go ahead and we'll recheck the aura. Let's see how the aura has changed with just a couple of minutes of balancing. I do get also emails from time to time where people complain that their 0 setting is not allowing them to run the frequencies all night. So I really don't recommend. That's an interesting change, isn't it? Let's go ahead. It's a kind of a lighter and brighter, but it's this deep dark green and then the red. So we've moved into a place of really working on the physical, and we've got some kind of emotional energies that we're working out with that dark green. So I do think, it's only 2 minutes in, we sort of begun the sort of active healing process in the body. This thing is in slow motion over here. That's pretty funny. Okay, so then here's the beginning, and then here's the progressed. All right, so let's go ahead and see what we've got here. Placebo effect in the presence of the practitioner. The patient is visually influenced. Scalar in the live session. Placebo, and okay, we got positive energy, adding frequencies. I think it is the added effect. I don't think that the quantum capsule frequencies are not effective. I think that they are very effective. But everything is frequency. You are frequency. So I think there's an added dimension when you're in the picture. When you're actively working with that person. Okay, it just they're getting a lot of feedback from you. They're getting a lot of that you care about them, and they're getting that in the live session. I think it just comes down to a matter of preference, but you are in the field, when you're working with them, when you are looking at the problem with them, it's even more powerful than when a person looks at the problem on their own. That's why if you're a practitioner, it makes sense for you to also buddy up with someone else where you could trade sessions from time to time. Because even if you're excellent at running sessions, you yourself will have a more powerful session if somebody else does the looking and the checking for you. There's that added element of their frequency in the equation, and even just their intention of working for you, their intention of healing, their power of prayer, which comes through in their intention of doing a session for you. Well, every healer's intention is that you will get better, you will improve in some meaningful way. And that energy is coming through actively in that live session. And maybe it isn't as clear as when they're getting the capsules, and certainly not when they're running it for themselves. So crabapple is maybe, like time for a detox. Spring, wood rising, it's time for a detox. I'm now turning a corner and moving in a positive direction of tooth health. And then it's really telling us tooth 16 coming up. Saltwater rinse is something you may want to add in. Saltwater is so great for healing the energy. Just think of an Epsom salt bath. So you're going to heal all the energy in the mouth, and also is great for healing infections. Well, let's bring her back on and hear what she has to say. How did this land with you, Dahlia? What are your thoughts?
Oh, I love it. I mean, it looks like there's so many libraries to help with it. And I wrote down the tooth numbers. It'll be interesting. I'll look at the chart later and see. But yeah, I feel like this is really helpful, and it gets in there, a lot more with that microscopic truth of what's going on energetically. And I need to look at it. And I've just been sort of avoiding not looking at it. I've been so busy with a jillion other things. So this helps me feel like,
Oh,
yeah, we're peering into it, we're seeing, and then I can in real world actually go seek out a biological dentist too. Yeah, really informative.
that is
Yeah.
awesome. That is awesome. Yeah, absolutely. Well, I'm happy and I'm glad that you volunteered for this. Did you have a quantum capsule, right? So we could send this
I
to you
do.
in the quantum
Yeah,
capsule.
I do. Thank you. Oh, I'd
So
love to listen
yeah,
to
go
this.
ahead and put that email into the chat so I can take care of that for you
Okay,
and send it to you.
for sure. Okay, I will
So
do that.
let's answer any final questions or thoughts. The client feels more supported and more trusting, also more focused on the therapy and the presence of the provider. You had some thoughts on this, Dahlia. Why don't you go ahead and share what you were thinking about this?
Yeah, I was thinking that when a practitioner is present, like what you said about the intention, but also we have that observer effect in play. So I'm observing someone, and they're receiving, and you're witnessing, and you have this different level of expectation that helps they entrain to that. They literally entrain to your enthusiasm, your energy, your frequency. And so that observer effect is in full play. So absolutely, when you're not present, they're listening with the capsule, but if they feel like, they have to come see you, well, have them come see you once a week, and then they can listen to the frequencies on their own in between.
That's a really good idea. That's great.
Mhm.
And you should charge more for those live sessions so that people will see the difference between having the live time with you, because your time is valuable, versus getting the remote session. So I will take care of this actually after class so I can get all of those to you.
Okay.
And
And
did you
Ariel, I
put,
wasn't sure what email you have me in.
you have to put your email that your capsule is under. Actually, go ahead and
I'll double check and send
yeah,
it to you.
send that to me in an actual email,
Okay.
so that I can take a look at it. All
Okay,
right,
great.
Dahlia, thank you
Thank you
so
so much.
much.
Yeah,
It was
thank you
great
so
to have
much.
you.
Okay,
Yeah,
thank you.
fantastic. Thank
Bye-bye. See you
you.
next time.
Sounds good. That's great. Okay, fun to work on. I mean, it's so fun with the genius. You know, you are the observer. You're helping the person just by observing and being, you know, curious about what's going on with them. And so we have the holistic dental course here, and you can purchase that for 40% off. This, it was just the 40 dental code. And we have all the libraries where you can get them for 40% off. Have fun testing yourself and testing other people and working on those wonderful dental connections. And we'll see you next week. Have a great week, everybody. Take care. Be well. Bye-bye for now.